Dr. Ahmed is a licensed clinical psychologist working in psychosocial oncology at Henry Ford Cancer Center in Detroit. She is passionate about caring for people faced with brain tumors, cancer involving the nervous system, and other conditions that bridge psychology and medicine. Currently, she is integrated with the departments of neurosurgery and neuro-oncology at Henry Ford, helping patients navigate the complex emotional and cognitive challenges associated with their disease. Her talk is Psychological Well-Being and Quality of Life in Individuals with Acromegaly. Please welcome Dr. Ahmed.
Good afternoon, everyone. Thank you for having me today. I'm Marwa Ahmed. Like Jill said, I'm a health psychologist working out of Henry Ford Cancer in Detroit. I do primarily work with patients with brain tumors, so that means like malignant neoplasms, cancers of the brain, but also other rare diseases and brain, spinal, and cranial tumors like acromegaly. I want to thank Dr. Asmaro for inviting me today. I appreciate being here. I do not have any disclosures to report. Sorry, how do I do this? I guess. There we go. Okay. So no disclosures to report, but I do want to go over the objectives of my presentation quickly. My goal for this presentation is that people can walk away being able to identify some of the common psychological and cognitive symptoms and challenges in patients with acromegaly, describe some of the healthy and non-healthy ways of coping so that we can keep an eye on these as we go through our medical journeys and know when to intervene. And also discuss some resources that can help support and improve a patient's quality of life as they go through this medical journey. Okay. I apologize. I think some of my font might be a little smaller, but I'm always happy to clarify at the end if anything is unclear to people. So first, let's talk about why psychological or mental health is important in patients with acromegaly. Why do we discuss and explore this topic? Well, just a little bit of a background. Most pituitary tumors or adenomas grow slowly, aren't dangerous, but 1 in 6 are functioning pituitary tumors that are known to cause acromegaly. So unfortunately, it is common. And acromegaly doesn't just affect the body, right? It also deeply impacts our mental health. Many people experience depression, anxiety, trouble thinking clearly, trouble with their memory, fatigue, right? Physical pain that impacts the mental health. So many different aspects of the disease are challenging for patients with acromegaly, and they're just as important as the physical ones, and they deserve attention and care as well. So living with acromegaly can be emotionally challenging. I think that's something that we can all agree on. Just gonna get into a little bit of the statistics, so I'm gonna nerd out for a little bit, but bear with me. So studies show that up to 63% of people with acromegaly experience mental health issues. So that is a very high number. The things that were noticed most in these patients were depression, anxiety, or affective disorders, just another fancy way of saying mood disorders. These issues can continue even, or were found to continue even after hormone levels were brought under control. So even when the disease was controlled or went into remission, these issues were still there. But unfortunately, because it's not talked about enough, they may go unnoticed or untreated for a long time. These mental health issues can be even more pronounced in younger patients, so people with younger onset, with a longer duration of the disease. And that's why early diagnosis and treatment of acromegaly is so important, not just to manage the physical health piece of the disease, but also to protect the patient's mental and emotional well-being throughout the process, and to also prevent additional distress and psychological complications that come with the disease. So in our practice and in lots of in the practice of other psychologists that focus on rare diseases, I think we tend to focus on the person as a whole person rather than just an isolated disease. We don't look at just physical health or hormone levels. We also look at the mental health, emotional well-being, day-to-day functioning, as that makes you, that is the whole person. It's important for us to look at that from that perspective. So nerding out with stats just for a minute. So what you're seeing on the screen here is are the results from a systematic review. And essentially that just means a really large review of studies that looked at acromegaly and psychiatric risk. And in this particular review, the risk of developing psychiatric diagnosis was assessed in patients with acromegaly and also compared with patients with non-functioning pituitary tumors, and also the general population. So there were, not only are we looking at the risk, but we were also looking at comparison groups. The results are here on the screen, but I have another table that breaks it down, makes it a little bit easier to understand, because those stats are a little confusing. So when broken down, the results from this review show us a couple of things. One, people with acromegaly are over twice as likely to develop depression when compared to the general population, so just healthy individuals, and nearly twice as likely as patients with other pituitary tumors. Oh, I'm so sorry. This down. Okay. There we go. I apologize. And another thing that we can see from the results on this table, that anxiety is also quite common, with acromegaly patients being about 50 to 85% more likely to experience anxiety when compared with other pituitary tumor patients. Compared with the general population or the healthy people that you see on that first line, anxiety risk is a lot higher. But the statistics are not very certain. We could just speculate that it's higher, but we don't have statistical significance there. And another piece that was important from this review, and even though this data is not included here, the review showed that a larger portion of acromegaly patients were treated with antidepressant medications when compared with patients with non-functioning pituitary tumors. So all that to say that the risk of anxiety in people with acromegaly is common. However, the risk of depression is significantly higher than both healthy individuals and those with other pituitary tumors. So certainly something that we want to keep an eye on, monitor, assess for throughout the process. All right. Sorry, I'm trying to be mindful of time. Okay, so next I'd like to talk about the causes of depression. If we want to take a deeper dive into the research, the literature, depression doesn't always match up with how active a person's disease is. I think if you guys were to take away one thing from this, please know that it doesn't develop in just people with active disease. It could develop in people in remission. It could develop with people that have been diagnosed 20, 30 years ago. It could develop at any point, regardless of what the scans or the hormone levels say. And that's because depression and other mental health issues are often more connected with how the disease impacts you as a person. So that means your body image, your self-esteem, your energy levels, your fatigue, just daily life in general, right? Rather than just the physical disease itself. And while the hormonal and physical imbalances related in acromegaly are believed to play a role in the development of depression, many people with acromegaly still experience symptoms even after their hormone levels return to normal. So again, kind of what I was saying earlier, whether or not the disease is in remission or controlled, whether or not the hormone levels return to normal, depression still is a risk, unfortunately. One thing that is documented very commonly in the research is that long-term changes in appearance, joint pain, other complications can continue to impact how people feel about themselves and their quality of life, right? Healthcare tends to focus mainly on the lab results and the scans, and all the wonderful doctors that are here today, I mean, they're looking at the whole person, right? They're looking at sleep, they're looking at their ENT, functioning overall. But unfortunately, that's not done everywhere. It's not very common practice. And so it is important for us to identify these concerns and to talk about them, evaluate for them more commonly than what we're doing right now. Okay, so now that we've talked a little bit about the research piece of depression, I wanted to include some of the symptoms that are most concerning when a psychologist is looking for depression in patients. This could be incredibly important so that when you feel that you might be depressed or you feel like your spouse, your partner, the person that you're caring for with acromegaly is starting to experience some of these symptoms, that's when we want to say, hey, what's going on? Is there something that we can do? Should we talk to somebody? Just awareness of these symptoms, I think, could be helpful for patients and their caregivers. Before we get into the symptoms, though, I think it's important for us to talk about depression being different from just having a bad day, right? And I think we want to normalize that. So having a bad day could just be feeling sad or feeling low about something, feeling stressed about something, maybe for a few days at a time, sure. But generally speaking, you can bounce back to your normal self. However, when we're talking about depression, the symptoms typically last much longer and they're much more severe than what we just have on a bad day. So symptoms can look like prolonged feelings of sadness. What we look for is typically around 1 to 2 weeks consistently. Feeling sad, loss of initiative, loss of spontaneity in relationships and at work or in something that you're passionate about, frustration, anger, a lower self-esteem than usual, a distorted body image. Again, we're talking about a period of time where these symptoms seem a little bit more severe and intense than your norm. Also, social withdrawal is a big piece that we look at. Fatigue and emotional exhaustion are also very common. Those are a little bit tricky though, because acromegaly is often associated with disease, right? And like Dr. Gannon was mentioning earlier, sleep apnea is also a significant piece here, and so is fatigue, right? So we do want to be mindful and differentiate regular fatigue and fatigue that's associated with depression or mental health, because those two things can look different. Next, let's talk a little bit about what to look for when we talk about anxiety. Unfortunately, in my work, especially in downtown Detroit, I realize that a lot of people don't know what the word anxiety means. And so it's important for us to differentiate. First, just want to say untreated anxiety can really impact somebody's quality of life. And there are multiple types of anxiety responses that we look for. There's something called normal adjustment, which is probably what the majority of patients present with. So something like, I'm struggling with this diagnosis, or I'm struggling with this particular piece of my disease, but I'm coping with it, I'm coping with the emotions, I'm problem solving, regardless of how tough things are. And you do feel normal vulnerability during these periods, but they don't last for very long. However, anxiety, high level of anxiety, looks a bit different. So there was a focus group study that showed that people with acromegaly had specific fears that led to high anxiety. And those fears were things like fear of collapsing, fear of disease recurrence, fear of just having this impending fear or this feeling of dread that doesn't leave you, jealousy, frustration, persistent thoughts about your disease. All of those are different forms of anxiety, and sometimes people don't even know it. But if they last for a long time, if they impact your quality of life or your day-to-day, or if they're pervasive, meaning they occur for the majority of the day, nearly every day, that might be a sign that we want to seek out help. There we go. Okay. Just real quick, other signs and symptoms of mental health concerns that we want to identify or talk about, even amongst ourselves and our families, are changes in social functioning, such as social withdrawal, like I said earlier, due to changes in your body perception or your body image, your motivation, changes in sexual functioning. There were studies that suggest a link between mood alterations like anxiety or depression and cognitive functioning, which we'll talk about in a little bit. But essentially, a lot of people with acromegaly have reported changes in their memory, in decision-making, problem-solving, attention. It's not incredibly common, and it may not be as common as depression and anxiety, but cognitive concerns do come up, unfortunately. Attention, the ability to adapt to change, has also been documented as an issue for some people. And also some people report some trouble sleeping or feeling more tired than usual, which we kind of alluded to earlier. Okay, I'm gonna glaze over this section just in the interest of time. So as mentioned, some patients do experience changes in sexual functioning. The research mainly focuses on changes in sexual functioning for males, unfortunately, more so than females. So what we know so far is that growth hormone can negatively affect our sexual health. For males, it's low testosterone level, decreased sexual drive, erectile dysfunction. For women, it could be body image based on enlarged facial features, skin changes, irregularities in your menstrual cycle. So all of those things can have some level of sexual burden on our patients. And just an overview of cognitive functioning, lots of literature reports dysfunction in concentration, distractibility, ability to learn, memory, recall. So your ability to remember recent events or your ability to remember certain words or changes in your speech sometimes can happen. Sometimes people with acromegaly have reported reduced functional capacity at work. Unfortunately, right, maybe more so than we'd like to admit. This is something that does come up, right? Difficulty concentrating at work, difficulty collaborating with others at work, difficulty showing up when there's a team building activity due to changes in your body perception, or you're not feeling good, your joints are hurting, or you're too tired, or the list goes on, right? But there's been lots of issues in the work environment related to both cognitive functioning and body image. And also some people unfortunately have to take some time off from work. So that can also have a negative impact on somebody's self-perception. All right, I'm going to skip this slide for the interest of time and shift gears to talk a little bit about treatment and coping skills. So there are many ways of unhealthy coping, as we may know. So some people sometimes cope with their issues or with their disease by substances, right? We maybe drink excessively or drink irresponsibly. We avoid or prevent ourselves from thinking or facing our problems or facing the disease itself or the symptoms that come with it, neglect our self-care, talk to ourselves in a negative way that could have a really big impact on our mood and mental health, and also withdrawing from social environments. So obviously this list is not extensive, but just some of the more common unhealthy coping skills that I see. And these are the more healthy coping skills that we want to implement or choose for ourselves. So the best and most common treatment for psychological issues in acromegaly is psychotherapy, whether that's individual or group psychotherapy. Essentially doesn't matter, the outcomes are really the same. But CBT, or cognitive behavioral therapy, is generally the best treatment for this kind of issue. And when I say issue, I'm talking about depression, anxiety, negative self-talk that's related to the disease. CBT is the best way to approach that. Sometimes antidepressant or anti-anxiety medication can be just as helpful. However, research shows that both psychotherapy and medication together give you the better outcomes, the best outcomes. Psychotherapy alone, medication alone are great and effective, but together they give you the the best outcomes essentially. Support groups are really great. So Facebook groups, as they're developed and people talk amongst themselves and meet other people with the disease, could be incredibly helpful and healing for people because it can normalize your experience and you realize that you're not alone, right? There are other people here in your very community that are facing the same issue that you are. Also, just online support groups through your healthcare network or your doctor's office. Sometimes medical institutions will hold support groups for rare diseases, and it could be helpful to just show up and talk to other people, other families that are facing similar things. And a multidisciplinary treatment approach, of course, so a team of endocrinologists, neurosurgeons, neurologists, psychologists, et cetera. That is typically the best way to target overall quality of life in acromegaly. All right, so again, in the interest of time, cognitive behavioral therapy has been the most evidence-based psychological treatment for patients with acromegaly that are facing depression and anxiety. There were a team of researchers that developed this cool Think Healthy and Feel the Difference coping card that I found really cool. Unfortunately, for copyright infringement purposes, I couldn't print it out and bring it in. But I thought I'd put it on the screen here if anyone wants to take a picture of it. Essentially, this is something that has been tested in patients with acromegaly in a CBT research protocol. So patients with acromegaly and healthy controls were asked to go through a 12-week protocol of CBT with the focus on this coping card. So essentially what it targets is automatic thinking, which is the avocado peel, which is not related to reflection, essentially just your brain, the thoughts that you have on a normal day-to-day basis, conditional beliefs, which are the flesh, the level of cognition that's associated with your behavior. So you have a thought and then a behavior follows it. That's the flesh piece or the conditional beliefs. And then core beliefs, which is the seed, so the deepest part of the avocado, in which the absolute and rigid thoughts live. So absolute or often negative, rigid beliefs that we have about ourselves. I'm unlovable, I'm a failure, I'm, fill in the blank with something negative about yourself. That's something that is common in acromegaly and also just the general population. And so when tested, this coping card was found that as people carried it around and implemented the concept behind it, which is I'm going to focus on the things that are within my control, which are those automatic thoughts or just the concept that I have about myself, then you tend to live a healthier lifestyle. You tend to have a better quality of life versus just believing all the automatic thoughts that you have on a day-to-day basis. And unfortunately, we have thousands of them throughout the day. Oftentimes, they are negative. I tell all my patients that about 90% of them are negative, if not more. And if we walk around life believing all these negative thoughts or automatic thoughts about ourselves, then unfortunately, we tend to become, we tend to enact those beliefs in our day-to-day interactions with other people. All right, just a few other things that healthy coping skills for memory thinking changes. So things like using organizational efforts or using a pill box for your managing your medications, setting reminders, alarms on your phone to help keep track of things that may not easily come to you, giving yourself some extra time to complete tasks, writing information down so that you don't forget it, maintaining a consistent schedule, like for example, keeping your keys, wallet, and phone at the door every day and you grab them before you leave so that you don't have to rely on your brain to remember where they are located. SMART goals are really great for managing fatigue in all patients, not just those with acromegaly. So SMART goals stand for specific, measurable, attainable, relevant, time-bound. Essentially, what you want to do is you want to break down your goals into small, measurable goals. So if your goal is to lose 30 pounds, but you know it's not going to happen in a week, right? Or else you'd have to be at the gym all day. And also you don't have enough energy to exercise that much. So we build small exercise goals. So I'm going to walk for 5 minutes, 3 times a day. When I master that, I'm going to walk for 10 minutes, 3 times a day. When I master that, I'll increase it to 15, 20, et cetera. So those are SMART goals. They make you feel productive, and it's also really good for fatigue management. Counseling for sexual changes can be really great. This does require some specialized training, but there are some sexual therapists out there that can help patients and their loved ones cope with the psychological and physical aspects of sexual dysfunction related to disease. Let's see. Sorry. Relationships and social support are also very important. I know typically when we are feeling depressed or anxious, we have a tendency to withdraw or avoid people or people that we love. However, research shows that relationships, social support, talking to other people with or without the disease can be incredibly helpful for our mental health. And as we mentioned before, it's important to seek professional help when we feel like the symptoms just aren't going away. When they're sticking around for longer than a few days, when they're impacting our day-to-day, when they're impacting our interactions with others or our functioning at work, that's when we really, really want to reach out, at the very least, to your primary care, to a family member who can reach out on your behalf. So a health psychologist like myself can help. Psychotherapists can be incredibly helpful for this as well. Psychiatrists, nurse practitioners can help with medications for depression or anxiety. Okay, I apologize. I know I had to scroll through some of that, but essentially the summary and the take-home messages that I want everyone to take with them is that regular mental health screening and early intervention is incredibly important. Some primary care doctors will assess for depression and anxiety. They'll probably ask you a 2-question questionnaire every time you have a well visit. However, it's really on us as patients and as families to report whether we're struggling with mental health, because it's usually undetected and it goes untreated for a long time. Signs of stress, like I said, worry, anxiety, prolonged sadness, hopelessness, lack of social engagement, and there's lots of healthy coping skills that we can engage and implement, whether it's through a psychotherapist or a psychologist or just some of the things that we talked about today. All right, so I know that was very quick, but lots of things to talk about. If anyone has any questions or just follow-up concerns that they have, you can always reach me by email. Unfortunately, my phone is not available because my secretary takes those calls. But if you email me with anything, any questions, or if you want a copy of these slides, I'm happy to respond back. All right, and that is my talk. Okay.